Hello and welcome back to the Women's Heart Health Summit. This is Dr. Mark Menolascino, and thank you for joining us for another installment of the Women's Heart Health Summit. This is your chance to hear from international experts to get the latest information of how to find optimal heart health and vitality for you. Today, we're fortunate to have Dr. Felice Gersh. Thank you so much for being with us today, Felice.
Oh, I'm so happy to be here and join you, Mark.
Well, let me brag a little bit about you, Felice. We've known each other. We're colleagues. We're friends. I've had a lot of respect for all the work you've done, and I love listening to you speak because I always learn something too. Dr. Gersh is that rare combination of an award-winning physician, a board-certified obstetrician gynecologist, and also board-certified in integrative medicine. Her educational background includes an undergraduate degree from Princeton University, a medical degree from the University of Southern California School of Medicine, and she did the 2-year fellowship in integrative medicine with Dr. Weil in Tucson. Dr. Gersh has dedicated her career to women, focusing on the aspect of women's health which are unique, underappreciated, and poorly managed. She's the medical director of the innovative integrative medicine group of Irvine, leading a team of skilled holistic practitioners, one of the best centers in the world. Dr. Gersh is sought after nationally and internationally as a speaker. She's a published writer of book chapters and a prolific blogger. She's been featured on numerous web summits, podcasts, radio shows, and her own segment, A Healthy Perspective, which is heard weekly on LA Radio, AM KRLA 870. And her first book on PCOS will be available later this year. Thank you so much, Felice, for joining us.
Well, as I said, Mark, it is a great pleasure. And every opportunity I get to educate on women's issues is just a blessing for me.
Well, as you've done so well in your one-to-ones with women and in your speaking, you know, women's medicine really wasn't done well. It wasn't personalized. And that's maybe the beauty of the whole integrative approach. When a woman comes to see you, how do you start? Where do you start off getting to know this person or getting to connect at that deeper level?
Well, one of the wonderful things about having the kind of practice that I do have is that I have the time to really let my patients speak and tell their stories and, you know, go through the timeline going way back into their childhoods, because we know that the health that you have as a child and the emotional environment that you grow up in is really going to set the tone for the health for the rest of your life. So I get to hear them tell their stories and, you know, look at them in the context of their whole lives, you know, the relationships they have, the kind of jobs, their environmental toxins, emotional, and, you know, in every other which way, you know, chemical, biotoxins and so forth. So I look at every aspect of the woman and her health, and I ask her what her goals are. And then I do a thorough physical exam, and then I do a lot of testing. I love testing because...
Well, you know, you're talking about trying to find that ideal testing, and a lot of doctors don't really understand the testing because the type of testing that you do in your clinic is not the way we were taught in medical school. And trying to personalize hormone testing especially is really quite difficult, isn't it?
It is, and I wish we could have more research on it. I look at all aspects in terms of testing. I look at inflammatory markers very, very heavily, and as a clue to everything, you know, because we know that there are many causes of inflammation, but once inflammation is established, it's the root cause of most everything that follows. Yes. And that, of course, includes cardiovascular disease, which is the most common cause of death of women. And most women don't realize that, even doctors don't realize that. Yes. They still think of breast cancer as the number one killer of women. And of course, that's a very big problem, but it is far from the number one killer of women. And you know, we have to look at the underlying causes of inflammation, which of course then affects women's hormones. And one of the big things that I look at, depending of course on the age of the woman, but a reproductive age woman, her menstrual cycle is really a vital sign of her health status. And our conventional medical world doesn't understand that. And so we now have really an epidemic of young reproductive age women with totally abnormal menstrual cycles. They have irregular cycles, PMS, they have terrible menstrual cramps and so forth, heavy bleeding. And then they go to a gynecologist and the solution is always like so cookie cutter, put them on birth control pills.
Yes.
And that is, I always use analogies because it makes me understand things the best. So I look at the wall, I say, look, you have a wall. It's full of mold and termites, but you don't really want to deal with it. So you just cover it with some nice, attractive, heavy-duty wallpaper.
Great
But
analogy.
the day of reckoning
Great
is
analogy.
going to come for women when they have an abnormal menstrual cycle that is so foundational to their health. In fact, what has been lost is that fertility itself is a vital sign of female health. And we're covering it up. We don't understand, we, meaning conventional medical world, understand that hormones are not just about making a baby. You can't just erase hormones by putting women on birth control pills and expect that everything is going to be fine. I would say it's like the analogy of, you go to buy a car and they say towards the end, well, you can have a sporty package where you can have, cuter hubcaps and you can have a pretty metallic finish. And it's, an extra $3,000, but you can take it or leave it. The car will run the same way. And that's how people look at reproduction. You can take it or leave it. But really, it's like the transmission. You can't go and buy a car and say, I think I'll skip the transmission today, But that's what reproduction and the rest of the female body is all intertwined. So when you basically, cover up the reproductive functions in some fashion, like with birth control pills, you're actually impacting in a very negative way all the other functions of the female body. And that's really one of the points I always have to drive home, because it's not appreciated, is that you have to address what's going on when a woman has abnormal cycles. That is a sign that she's not well. And it's usually a sign, obviously, of inflammation. When they have really bad menstrual cramps and heavy periods, they have an overproduction of prostaglandins locally, which, the menstrual period itself is an inflammatory process. And estrogen is very low at that point. And it's a sign that there's way too much inflammation happening in a woman. And instead of, dealing with it, we just try to cover it up. And birth control pills are not given to women, for example, who've just had a heart attack. Why not? Well, or smokers, why not? Because it's really bad for their cardiovascular systems. If it was so good, we'd say every smoking woman, quickly get on birth control pills. It's so good for your cardiovascular system. Or, right after they have a heart attack, So we acknowledge that it's really not good for your cardiovascular system. And yet we give it to girls who are 13, 14, 15. Yes. And I have patients on them for 30 years. Yes. And like there's data on that, and it's really impacting their estrogen receptors, which we now know are everywhere, Correct. Because reproduction and health is all intertwined. So, it's when I talk to women, and it just breaks my heart when I see all the symptoms and problems they've had and the solutions that have been offered to them. And of course, the price, they're kicking the can down the road. The price is going to be there to pay, that their health is going to suffer. And one of the ways that's suffering is that women have massive amounts of anxiety and depression, and birth control pills are contributing to that. We know that in younger women, they increase depression and even suicide. Yes. So, but that doesn't stop people, because estrogen is actually an anxiolytic. And one of the most interesting area that I'm just starting to explore is the relationship of estrogen and the whole endocannabinoid system. And it's very, very interrelated. And a lot of estrogen's effects in terms of the mood is actually through the endocannabinoid system. And there's a very heavily linked relationship there as well. And women do have to be very cautious. A lot of them don't know. And now so many states, including mine, which is California, have legalized marijuana for everything. And women don't realize that using marijuana can actually induce miscarriages, because the endocannabinoid system is very key to establishing pregnancy and then establishing labor. So used at the wrong time, you can create terrible havoc.
Well, you've brought up so many good points, Felice. And, again, the CBD is a very interesting area. And people who are using it really need to know what they're doing, because there's so much out there that's maybe not great quality. But you really talk about this inflammation. And, I love to think about women as this beautiful symphony of their thyroid, adrenal, female hormones, gut, and really getting that balance. And we can have 10 women come in with PMS symptoms that have 10 different paths of why that unique person has it. So that storytelling that you get from women really helps you key in on what's unique to that person and how you're going to really approach it. This inflammation process, we see it from the gut, we see it from toxicity. How do you tie what's happening to women and what's happening to hormones through these inflammatory mediators? What is it in their lifestyle? What is it in our environment that you feel like is driving this for them?
Well, it's like you mentioned, it's everything. One of my biggest areas that I just love dealing with is circadian rhythm dysfunction. And we now know that we live in a world that's really filled with circadian disruptors. Like, we eat at the wrong times, we eat all day long, we eat late at night, we go to bed too late, and we have very high levels of stress. And such a large percentage of the population now are shift workers.
Yes.
And that is a very huge driver to inflammation. And we now know that the circadian rhythm is absolutely essential to having good health. And all the organs have to work in this beautiful synchrony,
Yes.
which is completely lost when you have circadian dysfunction. And the other thing that is so amazing is that estrogen is actually very key to maintaining our circadian clock. Our master clock in our brain is
Absolutely.
really ruled by estrogen. So everything that contributes to altered estrogen levels, like endocrine disruptors, and we're living in a soup of endocrine
Yes.
disruptors, and a lot of the impact, the negative impact of these endocrine disruptors is actually on our circadian clock.
Interesting. The idea, Dr. Joe Pizzorno really has brought to light so much about toxicity, linking it to type 2 diabetes, insulin resistance. And I think your link of tying hormone disruption through toxic inflammatory stress really is not appreciated as well as it should be. And really, any stress can be toxic if it's internalized the wrong way. And you mentioned the childhood stresses, like the adverse childhood event scores. What happens to kids as kids affects their health as adults. And it's interesting how this is all tied together. Your daily rhythms, your monthly rhythms, your weekly rhythms, all of this tied together, and any of that disruption can throw that balance out of play. There's a lot of talk about estrogens or estrogen modifiers or xenoestrogens, these fake chemical estrogens in our food supply, in our cosmetics. Where do you see women being able to hedge their bets with reducing that exposure?
Yeah, that is, Mark, a huge cause of problems. And we're just learning, like, where are all these xenoestrogens creating havoc? And it's really throughout the entire body. It can start at the top with disrupting the circadian clock, the master clock. And of course, in the gut, there are estrogen receptors throughout every aspect of the gut, the lining cells, the enterocytes, the enteric nervous system, the enteric glial cells, which is the immune system of the gut, directly in the gut, and the muscle, every aspect, that is involved with the peristalsis, this really critical and very complex function of the gut. And we know that when you have endocrine disruptors, you actually alter the gut microbiome. And now we're looking at things like glyphosate and artificial sweeteners as actually being endocrine disruptors and xenoestrogens and altering the gut microbiome, as well as being directly toxic. As so many of these chemicals they have multiple negative effects. They're xenoestrogens, and they're also direct toxins, often direct neurotoxins.
Yes.
So women are especially vulnerable because we use all this makeup, and they've now shown that the average woman uses, a couple of dozen products, and many of these are filled with chemicals that act as endocrine disruptors and direct carcinogens. And it's really criminal. Like, I encourage my patients to save a ton of money and make their own stuff.
Great idea.
Great idea. You can use organic coconut oil. I happen to love organic shea butter, and I love essential oils, and their recipes, and I provide some, and they're easily obtained online and from aromatherapy books. They're very easy to get, and you can mix a few drops of always organic essential oils, and you create, you can go to Beverly Hills and buy a little bitty vial of something for like $200. And then when you look at the ingredients, it says things like organic shea butter and lavender, or
Yes.
frankincense, these lemon balm, these. And it's like, excuse me, I can make that for like $5, for the same amount. And mine doesn't have preservatives, because every time you buy a commercial product, they have to include a preservative because it'll grow something sitting around. And they can't do that.
Yes.
They can't risk having mold and other bacteria grow in their products. And so they have to have preservatives. And many of them, of course, include things like methyl parabens. And
Yes.
a lot of them include so-called fragrance, which of course are phthalates, which
Yes.
are another estrogen endocrine disruptor. So, just skip all that stuff, save a ton of money and make your own. And then when it comes to makeup, I mean, there's just a limit. I can't make mascara
Sure.
or lipstick. I don't know how to do that. But there are, organic mineral-based brands. And, you really need to look at that. We know that many lipsticks, they've had, all this, terrible press where they have lead in them.
Yes.
Like, who wants
Heavy metals and
it's like, yum, I'm licking my lead dose, and like, we don't have enough troubles already. So that, and then, there's been all this stuff in the past about talcum powder, that
Yes.
could be causing ovarian cancer. And the other thing is vaginal products. People don't want to talk about that.
Yes.
But, women stick all kinds of stuff up in their vaginas, and, they use lubricants that have chemicals and sometimes different scents. And they think that, they need to be washed out. You don't need to wash in there. Just a little finger in a little water is more than enough. It's self-cleaning, and you don't have to do anything more than that. And then, of course, women have such high rates now of vaginitis. And
Yes.
a lot of that is actually because of the contraceptives they're using. We know that different forms of IUDs are altering the microbiomes. And now we know that there is critical microbiomes of the vagina. And I was taught, now it seems so ridiculous, I was taught way back in medical school and residency that everything above the level of the vagina is sterile. And then you think about it, that is so insane. Was there a
Yes.
sign at the top of the vagina that says, bacteria do not enter, and they're going to read it? So now we know there's a microbiome of the uterine cavity, the endometrium. The placenta has its own microbiome, and so do the fallopian tubes and the ovaries. They've actually done studies on women with ovarian cancer, and they actually have a different microbiome of their ovaries than women without, ovarian cancer. And women who have things like gestational hypertension and preeclampsia in pregnancy have different microbiomes of their placentas. And I really worry now so much about women have these IUDs in, of whether they're the copper or they're the progestin, the levonorgestrel, which is really toxic stuff, increases breast cancer by 52% and so forth. And they're altering the microbiomes. They pull them out and they immediately get pregnant. And then so many women now are having dysfunctional labors, preterm deliveries, and so forth. And nobody's looking to link this to the contraceptive that they just had removed. And birth control pills increase your risk of acquiring sexually transmitted disease and vaginitis, different types, both yeast and bacterial, because it's altering the microbiome. We know after menopause, women have less estrogen, of course, and they have all kinds of vaginal dysfunction, right? They have, infections, they have urinary tract infections at much higher rates. Their bladders are colonized. In 70% of older women, their bladders are colonized with such things as
Yes, that's
Klebsiella and E. coli. And women with birth control pills are going to have very similar things because these aren't real hormones, and they're not with what you had mentioned, which are the beautiful rhythms of women. We're like these beautiful rhythmic creatures when we're in our reproductive years. We have our circadian and our lunar and our seasonal rhythms, and we have daily rhythms even within the circadian called ultradian. And we have pulses of hormones coming out, and everything is genetically programmed to be right on cue, right on time. And we've lost all of that. And then we wonder why people can't sleep, and they have, hypertension at younger ages. And we have all this emotional problem and an epidemic of, like I mentioned, depression. And it's all interlinked. And So, and then these endocrine disruptors, I mean, if you look at the ingredients of these IUDs that have the levonorgestrel and the birth control pills, actually, if you go to the toxicology site at the NIH sites, they're actually all listed as endocrine disruptors.
Yes.
And then we have all the chemical endocrine disruptors, like, mercury, like we have in California, what's called mercury fog. And a lot of people don't realize that mercury is actually an estrogen endocrine disruptor. And there's a lot about mold. Mold is an estrogen endocrine disruptor. It seems like everything comes down to in some way interfering with estrogen. And of course, it's not the only hormone. Thyroid receptor.
So let's take a breath for a moment, Felice, because what I'd like everybody listening that's joining us on Summit is to stop, rewind about 5 minutes, and listen one more time to what Felice just shared with us. And this is why I love listening to you. You put so many well-researched facts with I like to call them sound bites that people can actually eat. You put this very complicated data into a personable conversation that's really easy for me and women to follow. And I think as a practitioner, that's such a strength for you, that you're able to take these very complicated concepts of xenoestrogens, hormone disruptors, and put them in a way that people really, really can use. So let's develop this just a little bit, then jump into thyroid. You're talking about the endocrine disruptors, these chemicals. One easy thing our members can do here is to go to the Environmental Working Group, EWG, and look at the Clean 15, the Dirty Dozen. Look at the foods that you should and shouldn't be eating to get toxins in your food supply. As Dr. Gersh mentions, I think the number now is 121 chemicals the average woman puts on her body before she leaves the house in the morning. Turn over those cosmetics and mascaras and look what the other ingredients are. Look at your vitamins, look at your medications, look at those other ingredients, because all of those phthalates, parabens, talcs, FDC dyes, preservatives, colorings, all of those are hormone disruptors, then the heavy metals that she mentioned. So you really have to take a look at what you're putting in your body and what you're putting on your body. And I think a lot of women were never shown that, and it's hard to try to sort that out because it's hiding in a lot of cosmetics. I love your idea about making your own organic cosmetics. I've not heard any other doctor ever say that. Maybe Trevor Cates once. And that's just so powerful for women. Instead of spending a fortune on these cosmetics, they can make their own. And then hedge your bets on the organic food. Try to reduce that burden of these xenoestrogens and hormone disruptors. You were talking a little bit about mold, and I'd love to hear you share some ideas on that before we go to the thyroid. Because mold is something I didn't appreciate, and I didn't realize how much damage it's doing to the health of so many people. How do you tie mold toxicity? How do you find it? And how do you tie it to hormone disruption and women's vitality?
Well, the problem is, of course, mold's been around forever, right? Since the beginning of life on Earth. I think mold was here long before us. And we've lived with mold. The problem is our immune systems are not healthy. Even, it saddens me so much, but in children, like talking about from the very beginning, so many children now are born by C-section. They receive so many vaccines at such a young age, and they are often not breastfed for very long. And even when they're breastfed, their mom's gut microbiome isn't really healthy. So we're not getting anything what we need in terms of building the healthy immune system through having a good gut microbiome, which we know is critical to develop immune tolerance. And, all the other aspects of health start with laying down that good gut microbiome. And so from the very get-go, we don't have the best immune systems. And then, something like almost a third of people carry the genetics to have mold allergy. So mold can affect people in a multitude of ways. You can have an allergy to mold, just like you can have allergies to dogs or cats or grass and so forth. And then there's the direct toxic effect of certain types of mold, especially like black mold, the Stachy. And that is directly toxic, as well as, if you have an allergy. So, you have to look at these different ways that mold can affect you. And now we know that, all these different things with mold can actually grow in you. And this is so frightening because they've now dissected at autopsy the brains of people with Alzheimer's. and they find actual mold in their brains.
That is so scary.
It's so scary. It gets up into their sinuses. So this was sort of controversial for a while. Like, does mold really grow in you, or is it just affecting you? Well, now we know it really grows in you.
Yes.
And so it grows and it gets up in our sinuses and into our lungs, and then the sinuses are the entry into the brain. So, these little mold spores can actually get in, and of course, we know that all kinds of pathogens are getting into our brain, and
Yes.
anything that creates inflammatory process, neuroinflammation, can ultimately lead down the road to dementia. And
you're talking about dementia, Alzheimer's, and mold. And while I was teaching the reversing cognitive decline, this came up. And for women especially, dementia is a higher burden. They're higher caregivers because they do most of the caregiving, and the caregiving stress causes hormone disruption. But, could we shift a little bit and talk about what's the role of hormones in protecting the brain? We're talking about the heart today, but let's talk about the brain health, because I know that's one of your passions as well. How do hormones through a woman's life cycle need to be supported to promote optimal brain health?
Oh, it's so critical. So we have, we'll start at the very beginning here,
Please.
sort of the bottom, which is like the blood-brain barrier. Okay, so that is not functioning as a barrier very well in most people, and toxins are leaking right into the brain. And why is that? Because estrogen maintains vascular health. Of course, this links, brain health and
Yes.
heart health. So you need nitric oxide to maintain a healthy endothelial lining, the lining of arteries.
Yes.
And estrogen is key to having the function of the enzyme, the endothelial nitric oxide synthase. Without estrogen, you don't have that functioning properly. Right. And without healthy endothelium, you have what we call leaky arteries.
Yes.
And, you can actually measure that by getting microalbumins that shows that that's looking at vascular health in the kidneys, and you have leaky arteries and you leak out some protein into the urine. That's not a kidney disease, that's a vascular problem.
Yes, ma'am.
So you end up having leaky arteries, and you have a blood-brain barrier that is completely not working. And so the toxins get into the brain. Now, the brain has an amazing protective immune system, and it's all estrogen related. I mean, neurons in the brain are estrogen, and some neurons actually make estrogen. That's how important it is. The brain makes a tremendous amount of estrogen. That's how men get it. And men make 6 to 8 times as much estrogen. And what estrogen? It's all estradiol. And that's really important. The brain loves estradiol. It does not like estrone, and it doesn't do much with estriol either. Those don't do anything in the brain. It has to be estradiol. And the brain doesn't even have the enzymes to convert from estradiol to estrone. It doesn't like it. At least
we were taught in medical school the brain was a black box that didn't talk to the rest of the body. It didn't communicate with the immune system. It didn't communicate with hormones. It was its own little isolation at the top of the body that had no relation. Wow, have we really come a long way?
Well, we both had to unlearn just about everything. And and in the brain, we have the brain-related immune system, which incorporates the microglia and the astrocytes, which are the astroglia. They're related. And these are like our surveillance system. And when you have an inflammatory process, like an invasion, like if you had an infection going on in the brain, these are activated. They have 2 different states, sort of a resting state, which is actually not just resting, it's actually active surveillance. And then it goes into the active state where it actually starts gobbling, and secreting its enzymes, which are actually, toxic poison, but they're designed to dissolve bacteria and viruses that are invading. But when you don't have estrogen, these cells, these very important immune cells, which are actually derivatives of macrophages in the brain that develop from in utero time, in fetal time, they actually lose their control. So instead of being under control and then activating when it's appropriate to be activated, they go into a state of chronic activation, and they start secreting their enzymes, like their matrix and metalloproteinase. They start dissolving things, with their enzymes. And it's the brain, they can't distinguish between the invader and the actual brain tissue. And then, you end up with this massive state of chronic uncontrolled inflammation because the immune system is out of control because it needs estrogen to keep it under control. And that's one of the reasons why women have almost 3 times the incidence of Alzheimer's as men, because men make so much more estradiol in their brains, and women before menopause are doing just fine. They get plenty of estradiol from their ovaries. But after menopause, when the ovarian production ceases, the brain doesn't pick up the slack and doesn't make more. In fact, there's some studies that say for reasons whatever, they make even less. So women have real estrogen deficiencies in their brain, and they can't control these immune cells that need estrogen for control, and they become sort of like fuses that just go off at the least little stimulus. And as well, there are special neurons in the brain called serotonin neurons that make serotonin, that are of course involved in sleep and mood and cognition, and they are dependent on estrogen for their survival, and they start to wither without estrogen. And
Absolutely.
So your serotonin neurons with aging start to wither away, and that affects sleep dramatically, mood, and cognition in women.
So Felice, you're talking about this vascular issue of the brain, the vascular issue of the heart, and how they're related, and how estrogen is this common anti-inflammation device for the fire in the heart, the fire in the brain. What are some of the tools you give to your patients, or some of the strategies you share with them? Can you kind of give us your big 5 of what you can do to protect the heart and the brain at the same time?
Well, yes. And the good news is that our bodies are such that what's good for the brain is good for the heart, and vice versa. That would be really terrible if I said, the diet for the heart is poisonous to the brain. But that's where I always start, is with food, food as medicine.
Absolutely.
Because we know it's like amazing. I call them magic. They're called like the polyphenols. And polyphenols, which are these magical ingredients, and there's a whole slew of them, resveratrol and quercetin. There's so many of these polyphenols, the carotenoids, and they actually they can actually act on receptors of hormones. They can actually circulate in the body and actually substitute to some degree for estrogen. Some of them actually bind to even estrogen receptors.
And so what are some of the foods these women should be eating to get those polyphenols? Help bring it into terms they can.
And I didn't invent this, but it's eating across the colors of the rainbow, because there are so many different polyphenols. And so you have to eat blue foods and purple foods and orange and yellows and greens, and not just eat like broccoli. Now, broccoli is great, but you just can't just eat broccoli. So you need to eat, the more vegetables, the better. There's studies that show you can reverse even a lot of autoimmune diseases and such by eating tons of vegetables.
So try to get your 6 or 7 colors a day. That's a great piece of advice. What are some of the other rules as far as like saturated or unsaturated fats, the good fats, the bad fats? How do you advise women on those?
Well, I know the data. So if you eat a high saturated fat diet, I know there's so many people that are pushing the ketogenic diet, and except in very specific cases, that where you're treating a very specific condition, I am very against a ketogenic diet. I'm very against that, because too much fat, we know, alters the gut microbiome in negative ways. And you can create leaky gut just by giving mice, for example. And mice have a lot, they're not humans, but we know this is true in humans as well. If you give them a high fat diet, they will get leaky gut. And who needs that? We already have enough trouble, and most of us have leaky gut anyway.
And then how about intermittent fasting? When people ask you about that, where do you see that?
That is in my 5 or, top 10 or whatever number, the top. It's in the very top.
And how do you recommend doing it?
Well, I recommend starting with what's called time-restricted eating. And that helps to set the clock. So we know that as we age, as our estrogen goes down, our master clock starts to drift. And it needs to be entrained. That's the words that we use every single day. Yes. And, with light. So that's another topic. But, estrogen, without adequate estrogen, or in the presence of endocrine disruptors, you're going to start drifting. And so you live a life of jet lag, the equivalent of jet lag. And we know that plays havoc with every organ system in the body. So I do time-restricted eating. It turns out that the gut microbiome, the microbes, they have clocks too. And they don't know if it's light or dark, but they do know when they're fed or not fed. And they actually will respond differently. The microbiome is not the same 24 hours a day.
Yes.
So we have different microbial populations at different times. And there are some of them at night that actually swarm, just like insects swarm, in the presence of melatonin. But of course, you need to be sleeping and you have to have enough estrogen in order to make melatonin. So we definitely want to help our microbes to get on track. And by eating at the same time every day, not snacking, because you have to set your clocks in your microbes by having fixed times and stop snacking. And so you want to have a big breakfast. It actually has been shown that you can lose weight, for example, if you eat the same food mostly at breakfast versus mostly at night. So I want people to have a big breakfast. All this breakfast food stuff is junk, so think of sort of dinner and vegetables for breakfast. I like breakfast salad and, and so have some raw vegetables, some cooked vegetables. So have a good sized breakfast and have either a medium lunch or a medium dinner, but don't, try not to eat all the time, and try, if you have to snack, make it a little bit of fat, because that can fly a little bit under the nutrient sensor detectors. So like a few olives, some green tea, maybe a sliver or two of avocado, a couple of macadamia nuts, that kind of thing, if you have to snack. And stop eating by around 7 as many days as you can.
And that intermittent fasting seems to be so powerful. And one of our experts on a different session told us she doesn't like diets because the first 3 letters of diet are die. So we don't really like the idea of a diet. And so much money and time and energy has been spent by women on diets that have never worked. So really developing a personalized nutrition plan that works for you. Getting some protein in with the vegetables you talked about in the morning.
Absolutely.
I've always liked the breakfast like a queen, lunch like a princess, dinner like a pauper.
I like it.
More of your good calories in the morning. There are good fats and bad fats.
We agree.
How about women that come to you and say, my last doctor just said it's all about calories in equals calories out. I tried it, nothing happened, and I got frustrated and quit. What should I do next? What's your advice to that person?
Well, for people who are trying to lose weight or have inflammation, it's most everybody.
Yes.
Yeah, I do. After I get through the time restricted eating, where you have the time set, I like what we call periodic fasting. And I've worked with the Longevity Institute at USC.
Great.
And with Professor Balto Longo, who's so brilliant, and they devised the fasting mimicking diet. Because what happens when you just reduce calories is our metabolic rate slows. We know that. And then you actually have a reset where you will need fewer calories to maintain your same body weight as you needed before. And this is what happened in the TV show, The Biggest Loser, that they all gained the weight back. Because if you lose 100 pounds and you end up at 150, or you've always been at 150, the one who lost the weight through low calorie will actually need to maintain that weight by eating 500 to 600 fewer calories a day than the other person at the same weight. Nobody can sustain that over time. So that's why it always fails when you do that. But if you do periodic fasting, where you literally water fast for 4 days, which I can't get anyone to do, or you do the fasting mimicking diet, which I've done 13 times and advocate, and I can get success with this, where because you're eating, it's not a lot, but you get 3 meals a day, and it's only 5 days. And what that does is it actually works with our own innate body mechanisms for survival, because everything's about survival. And if you don't have any food coming in by day 3, the body says, now I need to get into action, right? So it starts killing off crappy cells that are using nutrients that we don't have, using up our valuable resources. So crappy cells get killed off, programmed cell suicide or apoptosis. Good cells get rejuvenated through autophagy, where they get recycled, their intercellular components, so that they get actually rehabbed. And then you get smarter, so you can go find food. So it increases brain-derived neurotrophic factor, the brain growth factors, so you feel calmer and smarter. And you start burning fat, of course, because you have no food coming in. And nature knows to burn the stupid visceral fat. So you lose your belly fat, and you actually get a smaller waist, and you reduce inflammation. So what they found in their studies is that mice get smarter, live longer. In humans, we have all the markers. So you lower your inflammatory markers. If you have high lipids, they get normalized. If you have high blood pressure, it gets normalized. And you do get increase in brain-derived neurotrophic factor. I know I feel super smart on day 5.
Oh, that's great.
I can beat anyone at chess, and I don't even play chess, really.
Yeah.
But,
one thing we see with women is that we share with them, no one likes the body fat on the outside, but really it's that visceral fat on the inside you mentioned that's really the most dangerous one. You were talking a little bit earlier, we're going to move into thyroid as we finish here. And I so respect how you see women as this whole system, as this symphony, as this unique person that has unique challenges, unique history, and needs a personalized plan. How does thyroid tie in with estrogen, with the hormones to protect the heart? Where do you see the thyroid heart connection?
Oh, it's huge. And just to mention, first off, that one of the things that happens in menopause is that thyroid is not functioning properly. So even if you test thyroid levels and you say, oh, they're fine, it doesn't mean they're working fine, because it's the beautiful rhythm of the menstrual cycle. When estrogen spikes that precedes ovulation, that spike of estrogen actually upregulates or opens up the receptors for testosterone, progesterone, and thyroid. So without a proper hormonal rhythm, the thyroid receptors are resistant. So it's so that you don't get proper thyroid function, which is why so many women in menopause and also on birth control pills think that they have low thyroid, and they go to the doctor and they read the book, they read online at Dr. Google, I have every symptom, and then the doctor checks their thyroid and says, no, another crazy woman, your thyroid is fine, stop reading Dr. Google.
How many times do we see that every week?
All the time.
Daily, yes.
Right. So thyroid is essential for cardiac function. We know that when people have low free T3, they have a much higher mortality rate. So we have to maximize thyroid. We want to get a free T3 to be over 3 for sure, preferably over 3.2. And so it's really important to have adequate thyroid, especially knowing that the receptors are going to be more resistant. We want to push the thyroid within the reference range, but into the upper area of the reference range when we treat women with thyroid dysfunction. And women have very high rates of Hashimoto's thyroiditis. So I just want to urge everyone to test for the thyroid antibodies, the thyroglobulin and the anti-TPO, because if you do not check, you will not find. And you will find a lot of Hashimoto's. And of course, they often have a lot of problems converting from T4 to T3. So you can't just measure TSH and T4, you're going to miss a lot of hypothyroidism. And the heart desperately needs adequate thyroid in order to maintain its proper rhythm and its proper beat and its proper strength of contracting.
Well, I feel one of my most satisfying things is to help a woman get her thyroid balanced, to get her estrogen hormones balanced, get the adrenal supported, fix the gut. That whole symphony works. Then I know her heart is safer. So,
absolutely.
Felice, I so appreciate you being with us here today. Dr. Felice Gersh, board certified OBGYN, board certified integrative medicine, runs the integrative medicine group of Irvine, and you're really one of the leaders in the field of personalized women's care. And I feel so fortunate to have you join us for the summit. Felice, how could our listeners find you or find out more information about you or read some of the work that you've done?
Well, if you go to my branded website, which is very easy, it's felicelgershmd.com. I have posted most of my blogs and Web Summit interviews and podcasts and so on. So there's a lot there. And there's also a YouTube channel that they can Google and find. So there's a lot there. If they would like to be a patient, I actually am one of the doctors, like you mentioned, that has a brick and mortar practice. I actually do see patients. And so my website for my practice is integrativemgi.com, and they can find out all about the practice there. As well, I love for people to follow me on Instagram and Twitter and so on. And my Twitter is at Dr. Dr. Felice Gersh. And, Instagram, I'm sure you can find me, but I have one that's under Dr. Felice Gersh and another under Gersh Felice. I have to combine them, but, that you can find me there. And Facebook is easy to find, just put my name in. And I have a book, as you mentioned, that's coming out, and it'll probably be, depending on, I'm not sure when this is going to air, but hopefully it'll be available at the time this airs on Amazon for pre-sale. It'll be actually out by the end of the year, and it should be available for a pre-sale very, very shortly.
Great.
And the basic name of it is PCOS SOS.
I love it. I love
It's
it.
all about the most common endocrine disorder of women, which is polycystic ovary syndrome.
Well, great,
So-
Dr. Felice Gersh. Thank you so much for being here. I always appreciate your wisdom, and thank you for sharing all of this great information.
My pleasure. Have a wonderful day.